Long lines and growing frustration have become the norm in recent weeks at many medicine dispensaries in Bogota. People have been spending up to 7 hours in line for life-saving medicines that are becoming increasingly scarce.
I only have anticoagulant medicine until tomorrow. I depend on them. They are essential. This is horrible and infuriating.
Una sociedad más democrática.
The government of Gustavo Petro has accused private insurers known as EPS of corruption and siphoning the available money to clinics they control. Since taking office, he has been pushing for a major overhaul of the system that would cut the insurers out, leaving the state as the sole administrator. But when the bill failed in Congress, the government intervened, taking control of 3 of the main health insurers.
Colombia's public-private system prides itself in providing near-universal coverage and relatively low out-of-pocket costs. Yet everybody agrees that it's in dire need of reform to improve the quality of its care and also ensure its sustainability in the future. What they disagree on, it's on how to do that.
The insurers say the government has withheld funds in order to precipitate the crisis, but surgeon Herman Bayona said that is not the case.
The government didn't force this crisis. The crisis already existed and was generating major damage in the health systems. It's affecting clinics and hospitals not owned by insurers, and patients are not accessing healthcare because we don't have the funds to do that. So the government that is the guarantor of the fundamental rights of health had to intervene.
But other medical experts say the government's actions are heavy-handed and technically unsound and could bring about a collapse of the system.
I believe it's a mistake because the government is proposing a law that is increasing costs without increasing revenue sources, and at the same time is fragmenting the system. And by fragmenting the system and making it more expensive without more money, what that implies is that people will not get the care they need and they deserve.
How to preserve or transform Colombia's healthcare system has become the latest ideological clash in this deeply polarized country, and that could further complicate the already difficult access to healthcare for millions of patients in need. Alessandro Rampietti, Al Jazeera, Bogota.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.